Hey guys, it's Ryan, and in this video we're going to be talking about histopathology and specifically how to differentiate between acute and chronic inflammation, especially when you see it in an unknown tissue sample. So here we have acute inflammation on the left and chronic inflammation on the right. And so we know about the differences in time course and in etiology, but the most important difference in terms of identifying them are the cells that these types of inflammation invoke and bring into the tissue. So the only definitive way to tell them apart is by locating the inflammatory cells and then identifying their nuclear outline. So we know there are always going to be white blood cells, but they're going to be neutrophils in the acute inflammation and mononuclear cells in the chronic inflammation. So neutrophils have this sort of what I call like a Mickey Mouse shape nucleus. So you can see one there, you can see one there, and it's because of the segmenting of the nucleus. So you kind of have to be at a certain power. You have to be pretty zoomed in to see it, but this is the way to differentiate a neutrophil from another white blood cell. So you can see how all these that I'm circling here have this kind of Mickey Mouse nucleus. And in contrast, lymphocytes, plasma cells, and macrophages all have a very clean, round, oval nucleus. So you can see the smooth edges, just very round shape. So that is the way to differentiate between the two inflammations. So here's another picture of acute inflammation, and you can see, here's a really good one with the segmenting, and you could go on and find a whole bunch of them. And here's chronic inflammation, and we can see all these inflammatory cells, and all of them have really smooth edges and round, oval, circular nuclei. So it really works. Again, you really have to be zoomed in to some extent to see this, but this is the primary method. So I'm going to ask you guys, what do you think this inflammation is, acute or chronic? So if you look around a little bit, you might see a couple of segmented nuclei. So all of these are essentially inflammatory cells, and you can see plenty of examples of the Mickey Mouse nuclei. So here. Of course, there might be a couple smooth, round nuclei, but I don't see a whole lot. I think it's mostly the segmented kind. So this would be a good example of acute inflammation. And this is actually a sample from a lung. This would be acute lobar pneumonia. So the inflammatory cells infiltrated the alveolar spaces, and we see some alveolar macrophages, some bleeding, and some other exciting things. So how about this sample? Is it acute or chronic inflammation? So if hopefully your eye went to this region of the sample, because this is where there's a big section of inflammatory cells, the dark purple nuclei, and you'll notice that most of them, if not all of them, have really smooth edges, and they're super round. And so you're going to see the lymphocytes, macrophages, plasma cells, and it's hard to differentiate between them, but all you need to know is that they're mononuclear. So there are plenty to pick from there. And this is an example of chronic prostatitis, inflammation of the prostate gland. So that does it for this video. I hope you found it helpful to differentiate between acute and chronic inflammation. And thanks for watching, and I'll see you all next time.